Hi everyone, I'm Santosh and we are from Team Go Global. Today we are here to talk about occupational health and safety. As we all know very well, currently we are at a crucial conjuncture and occupational health and safety is such a pivotal part of life of many health and related services employees and therefore it seems very time appropriate to brief all of you about this topic. The Canadian Centre for Occupational Health and Safety defines it as a health and safety program is a definitive plan of action designed to prevent accidents and occupational diseases. Some form of a program is required in occupational health and safety legislation in most Canadian jurisdictions. A health and safety program must include the elements required by the health and safety legislation as a minimum. As you could see, all workers have the right to return home each day safe and sound. Therefore, preventing work-related illnesses and injury is the most important job at any workplace. Next, I would like to explain few reasons for having occupational health and safety for all employees. Firstly, it eliminates possible dangers, safeguards employee productivity, it promotes workplace processes, protects employees' rights, and maintains worker health. With that, I would like to call upon my colleague Jay Desai to talk to you about workplace hazards in car repair and auto body shops. Thank you.
Hi, my name is Jay Desai, and I would like to speak about workplace hazards in car repair and auto body shop. So, type of employees that work in car repair and auto body shops are mainly technicians and mechanics. What do mechanics do? Mechanics work in many different industries, including aviation, automotive, commercial, industrial, or residential settings. Their main duties mainly include install, repair and maintain mechanical systems, prepare cost estimates and documentation for clients, use, clean and maintain various equipment and machines, supervise apprentices and other workers. Health and safety hazards for employees. Types of hazards includes accidental hazards, physical hazards, chemical hazards. Accidental hazards includes fire risk from fuels and other products, risk of railing objects when working under vehicles or with jacks, hoists, or hydraulic lifts, risk of eye injury from flying particles, risk of hand injuries, slips, trips, and falls. Physical hazards may include burns from battery acid, hot surfaces, exhaust, etc. Risk of pain or injury from awkward positions, repetitive manual tasks, or lifting heavy objects. Stress and exposure to noise also come under physical hazards. The last type of hazards is chemical hazards. It includes possible exposure to asbestos, exposure to chemicals, solvents, solder, and other products, exposure to gasoline or diesel exhaust. Welding hazards include UV radiation. What are some health and safety issues for mechanics? Issues like repetitive motion disorders, chemical and particle exposure, heavy lifting, slips and falls, mechanical injuries. How can mechanics prevent these issues? Repetitive motion disorders mainly develop because workers continuously place physical stress on one or more parts of the body, for example, places stress on the wrist. They can avoid this issue by taking frequent breaks if possible and perform stretching exercises directed by their physicians or physical therapists. Chemical and particle exposure can be prevented if workers protect themselves by wearing paint suits, respirators, or gloves as required. Heavy lifting. To avoid heavy lifting, mechanics can use proper lifting techniques, and to avoid slips and falls, mechanics can wear footwear with non-slip soles To avoid mechanical injuries, mechanics can use personal protective equipment to shield themselves from this type of injuries. What are some good general safe work practices that can help avoid injuries in a garage? Mechanics must make sure all motors inside the shop are turned off. Follow procedures shown on safety data sheet when using, handling, dispensing and storing flammable hazardous products. Use personal protective equipment such as gloves. Make sure that the area where they use products is well ventilated. Wash hands before eating. Use, maintain and store personal protective equipment according to manufacturer's recommendations. Learn about chemical hazards, WHIMS and STS. Thank you.
Hello everyone, I'm going to talk about workplace hazard in the office. Our basic assumption is working in the office must be comfy, safe, and hazard free. However, the real situation is not like that. Statistics shows office workers suffers thousands of health problems and injuries each year. Well, let's have a look to the next picture. What do you think about this picture? How many hazards are there? Well, take a minute and have a look. Well, how many did you find? There are 12 hazards in this picture. Well, in normal eyes, we don't see that much, but these hazards can create severe injury in office work. Let's look at some common office hazard. The first one is slip and trip. This is the most common hazard in an office workplace, generally caused by wet floor, a loose rug, or exposed cord. Next one is ergonomic injuries. This is really difficult to find out, but this is another most common injury in office work. Well, office workers normally spend many hours working in a computer, sitting at a chair, which actually cause this kind of injuries. Next one is violence at workplace. Well, normally violence means physical assault. However, in the workplace, it has a different definition. Any act in which a person is threatened, intimidated, abused, or assaulted in any ways in his or her work is categorized as workplace violence. Well, it can start very small but ended up as physical assault. This is a very serious issue in workplace. Next one is obstacle and collision. Then we have poor lighting, eye strain, and we have the fire safety. Well, this is another very important hazard because fire safety is not only going to harm the employees, it also going to destroy all the important documents which an office has for a very long time. So what can you do to minimize this hazard or prevent it? To prevent slip and trip, uh, the office should clean up spills immediately and use hazard signs. Office pathway should get clear all the time, or and all the telephone and computer cords must be buckled up and organized proper way so no one can trip on it. Violence. So what is categorized as violence? For example, rumor spreading, verbal abuse, psychological trauma, vandalism, physical assault. These are the example of violence. Well, it's always better to control the situation than dealing with the aftermath. There are some signs to identify a violent person. Mm, some of the signs are a violent person always will always have the disrespect for authority, refusal to acknowledge job performance problem, testing the limit to see what they can get away with, or handles criticism poorly. So these are the signs. There are many other signs. So this kind of signs actually give us a heads up for a violent person. So if anyone sees this kind of sign in a workplace, then they should immediately contact their managers or the HR just to inform them that this person is showing this kind of signs, and they should take action or poor lighting and eye strain. OSHA's guideline says we should take 10 minutes break each hour just to give our eyes a little bit rest. And we should also put our monitor below the eye level and about 2 feet far from uh, fire safety. To prevent fire hazard, we should smoke only in the designated area, monitor and replace any insulation, cracked electrical cord, avoid plugging more than one extension cord in an outlet, and always turn off the power at the end of each day. So, what are the workers' rights? Well, in Canada, workers have three health and safety rights: right to know, right to participate, and right to refuse. Right to know means all the workers need to know what are the hazards in their workplace. Health and safety is not one person's responsibility. It is all of our responsibility. So right to participate gives you the chance to keep your workplace healthy and safe. Last but not the least, the right to refuse. All the workers in any workplace has the right to refuse if they think the workplace is not safe for them or any of their co-workers. That's all from my side. Our next presenter will take over from here. Thank you very much.
Hello everyone, my name is Nishchit Sokal and here I'm going to explain the workplace hazards in the health clinic centers, community centers, hospitals, in which the employees, the workers deals with the homeless people, patients, everyone. So I'm going to explain it one by one, what are the different kinds of hazards they are facing. So the first one is the biological hazards. It may include the bacteria, viruses, insects, plants, and even human beings. These sources can cause a variety of health effects ranging from skin irritations, allergies, and other diseases. So right now we are at home, safe, protecting us from the COVID-19 is the best example of the biological hazards. The next one is the chemical hazards. The chemical hazards, many hazardous chemicals are present in the health clinic, which may pose an exposure risk for the healthcare workers dealing with the patients, with homeless people. For example, anesthesia, you know, right now we give an injection for the anesthesia, but before that we give anesthesia with gases. So those are the chemical hazards, so which the employee can face as well. We have to be very careful with these gases. The next one is the physical hazards. It includes toxic and reactive things, just like extreme temperature may cause burns and heat stresses. Mechanical equipments may cause abrasion and punctures to your body, and moreover, other physical agents such as laser, X-rays are come under the electrical equipment, just like noise, vibrations. Other, it can be harmful to the workers if not controlled properly. And the other, most important is the ergonomics hazards can contribute to the development of musculoskeletal disorders, which can, in this, it includes basically the patient handling and the awkward postures of the workers, and, dealing with the patients, handling and repositioning of the patients, and, the police, and mostly the posture is very important. These postures can increase the force on the joints and cause fatigue. I think the psychological hazard is one of the most important one. So violence in the workplace can be hazard to staff in healthcare and community care environments, which includes the anger, stress, feeling of being isolated. In healthcare centers, we will usually see that they can be easily exposed to the emotional situation, dealing with patients, dealing with homeless people, and with their families also. So another example of the psychological hazard is that because the nurses and the doctors have to have to create a balance between their work life and home life. So which can, will be the frustration and anger for them. So violence or aggression from patients, visitors, resident staff, clients take a form of physical, emotional, or mental abuse. So these are the common examples of the psychological hazards. What are the rights for the workers in the health clinic centers to be made aware of the hazard in their work environment, to ask questions about the health and safety, bring concern or issues to senior officers without the risk of discrimination, to refuse work that the worker has ground to believe poses an unusual danger. So these are the rights for the workers in healthcare centers. The preventive measures: keep work areas clean and tidy, use safety equipment, follow the guidelines, the posture, the the biohazard wastes. You have to take each and every prevention, how to use the chemicals, and do not afraid to ask questions to your supervisors. Know about the health and safety guidelines in your work environment. So these are the basic preventive measures in the healthcare center. Thank you so much. Thanks a lot.
I'm Fulusha Olanio, talking about occupational health and safety. Safety at the workplace enables organizations to comply with regulatory requirements and prevent high costs resulting from injuries and illnesses. Several workplaces can consider the fact that these safety measures would save their health and medical costs, which would arise when employees get involved in occupational hazards. To permit effective relationship with health and safety and work-related factors, it is necessary to create detailed information on workers' specific demands of the job, as well as objective information on the health and safety risks to workers in the job. Each workplace is different and dynamic. Therefore, the strategies used effectively manage health and safety procedures should be different and dynamic. The several strategies mentioned were designed to help achieve the vision of occupational health and safety, which is a catalyst to transform the way the system works. The employees and management can create a safe workplace through a shared responsibility model for workplace safety and cooperation. Organizational and organizations should own this perspective, and they should realize the fact that it is their managerial responsibility to focus on this perspective so that employees can remain safe. Protecting people on the job is in everyone's best interest, which includes our economy, our community, our fellow workers, and our family. Occupational health and safety adds value to businesses, workplaces, and lives. Conclusively, a safety plan is necessary, and it comprises certain steps that will develop a safer workplace. Organizations should make sure that everyone in the workplace is aware of the core problem. People should notify their respective supervisors, and they should file any reports if there is a problem. Finally, and importantly, an important aspect is that people should realize that there is a problem, as sitting back and holding on to the problem for a long time would not solve the problem. Thank you.